Hi everybody, and welcome to another menopause support video session. Today I'm delighted to welcome back Nick Panay. Nick is a consultant gynecologist and menopause specialist, and he's many other things too. Has special interests in PMS, PMDD, and heads up the services for menopause and PMS at both Queen Charlotte's and the Chelsea and Westminster hospitals. So Nick, thank you so much for your time again. It is much appreciated.
Great pleasure, Diane. Thank you for inviting me.
Okay, so as usual, when Nick offers us some of his time, I have a huge list of questions, and I know that we won't get through them all, but I'm going to crack on and ask him the first question, and then we will see how far we go. And you'll be able to find all of these videos via the Menopause Support website, which is menopausesupport.co.uk, or via my YouTube channel, and that's Diane Danzebrink. There are not two. So, Nick, first of all, lovely to see you, and thank you again. The question that I wanted to pose to you first, and is probably the one that I have been asked the most over the last few months, and in why I'm so thrilled to have yourself to ask, is around COVID and HRT. So what we have seen at Menopause Support, and what we've been asked a lot of times by those women who have been very settled on their hormone replacement therapy for some years, is that post their COVID vaccinations, they appear to have had a re-emergence of symptoms that has lasted for some time. Some of them are with GPs, some are with menopause specialists, and there really I don't have any research or data, because it's also new, that I can share with them. So I wondered, if you would kind of talk us through this and what you think might be going on, and also let us know what the potential outcome for this is, how long you think this might last, if in fact it is a phenomenon that you're seeing.
Yes, I think it's worth starting with what I've been seeing in my clinics, which is, as you say, people reporting an effect of the vaccine or COVID itself on their hormones, or hormone therapy, or their cycle. And we're getting reports of women whose natural cycles appear to have been disrupted by the vaccine, others who've been on the pill, others who've been on HRT, which tends to result in some symptom resurgence, such as the usual hot flushes and sweats, but maybe mood disturbances or brain fog, tiredness. Other reports include unscheduled bleeding, or where people have been having regular periods, then skipping a cycle or two. And there are various theories as to why that might be the case. We know from the natural situation that the ovaries are controlled by the hypothalamus, which is the lower part of the brain, through the pituitary gland in the head. And we know that stress can affect what we call the hypothalamic pituitary ovarian axis. And having a vaccine which stimulates an immune response is a stressful time for the body, and also a stressful time for the individual, particularly if they're concerned as to whether, they should have it and what impact it might have in terms of side effects, etc., etc. So you can see why it might disrupt the natural cycle. And in fact, there has been a publication recently in an American journal which indicated that women who've had the vaccine, their cycle can be a little bit longer on average. And those that have had the vaccine doses closer together appear to have more cycle disruption.
Right.
They looked at just under 4,000 women, so not a small sort of number, but it does need more research. There's less research in terms of the impact of women on pill or hormone replacement therapy, and why that might have an effect on their bleeding profile or the effectiveness of the treatment. And in those instances where you would say, well, if they're on the pill or HRT, then surely it's an artificial cycle or no cycle at all. So why is it having an effect? And for those instances, we think that there may be an effect directly on the estrogen receptors or on the endometrium, the uterine lining. And we know that there are, for instance, immune factors involved in, or immune processes and inflammatory processes involved in the menstrual cycle. And it's timely that you should ask this question, because this is a question that we have been discussing amongst ourselves as colleagues, and saying, really, we must do some further research into this to fully understand it. And the research needs to be done on a biological basis to understand the processes, but also on a population basis. So I hope in a year's time, if you ask me this question again, I should have more answers for you. But in the meantime, I think what's important is if people who are concerned about the impact do keep a diary of their symptoms, so that you and I can look at this and we've got something that is objectively showing us what's happening, and then we can follow that through. One of the things I would say is that for most, it affects 2, maybe 3 cycles, maybe up to 6 cycles. I haven't seen really many cases where it's had a long-term effect. So I think the reassuring thing is that it's a temporary effect, and that as far as we can tell, there isn't an effect, for instance, on fertility in the long term.
Right. So, okay. So kind of around 6 months-ish is sort of the longest that you're seeing.
But you know, we have to be cautious, because this is, of course, anecdotal. These are reports that we're getting from individuals in our clinics, and not from scientific research. But as I say, the more we look at, you know, sort of demographic data of people that are affected by these problems through apps and through, you know, prospective observational studies, then the more information we will get. And I think what we need to do, as I do with my patients with premature menopause, actually, is keep a registry. So in the absence of good quality randomized data, prospectively collected data, not just nationally, but globally, analyzed in as, you know, statistically sound a way as possible, should give us more valid information.
Yeah, I think that's really interesting, Nick, because one of the things that we sort of one of the groups that has really identified are those women like myself who are in surgical menopause and have been for many years, but have been very settled on their hormone replacement therapy. And then all of a sudden something's changed. And that's been, you know, kind of, that's been a real question mark for them. Well, okay, what's changed? Why have my symptoms reemerged? And I was really glad that you mentioned the psychological symptoms, because for a lot of them, it has been things like anxiety, low mood, etc., etc. So that would be an excellent strategy to have, as you say, to have this kind of collective place for information to go. And I guess, you know, kind of hopefully as we go forward, we'll be able to learn more about this.
Absolutely. And it's so important that we approach it in a collaborative way. So, you know, obviously I'm a gynecologist, but we need to work with epidemiologists, with people who understand, you know, the biology of the cycle and the bleeding mechanism. And also, you know, people who perform, you know, research into these complex sort of hormonal changes that occur at the time of menstruation and at the time of hormone replacement, to fully understand, you know, the impact that that the vaccines are having.
Slight kind of addendum, Nick, just for those of us who are not involved in research and don't know just how difficult it is to implement a research program. I know that you've been involved in a lot of research in the past, sort of in the current circumstances. How tricky is it to be able to sort of create a research program for something like this?
Well, obviously, you have to try and show that this is a priority area. And you and I have been fighting for many years for women's health and trying to put that on the health agenda and make sure that it is a priority. But I think that there is a realization that, and particularly as time goes by, and where, as a government, keep telling us having to live with COVID, and it being around, we're going to have to fully understand what impact it's having on our quality of life and long-term well-being. And this is where we're going to have more success in going to funding bodies like the National Institute or Health Research to obtain funds for large cohort trials, prospective cohort trials, as well as doing the more intricate sort of biological research as well. But it's not, it takes a while to get these applications in and to get them properly peer reviewed and then get agreement for funding. And that process can take years. The study that we put in an application for instance, for premature ovarian insufficiency, the POISE trial, we put in that application 5 years ago, and we're about to start the randomized trial now.
Wow.
So that gives you some idea how long these processes take. But in the meantime, if we are collecting data from apps for other reasons, then as with the Zoe app, we can collect information on hormonal aspects, and that will give us some earlier information. And I think that's what we need to do in the short term.
Yeah, I know I've been in touch with Tim Spector, and I know that the British Menopause Society have too.
Yes.
And that seems like a perfect opportunity, doesn't it?
Absolutely. We've already got some answers from it. We know that women who are in a younger age group on the pill, for instance, appear to have some protection against COVID. We know that younger women that have hormones seem to be more protected than postmenopausal women not on hormones. The frustrating thing is that the data at the moment are telling us that HRT doesn't seem to make a difference when you're in menopause as far as COVID is concerned. But that may be because we've just not looked at a large enough number of cases or looked at the right types of hormone therapy. We need to refine the data and ask more complex questions. And that's where, we need to go back to Tim and the group and say, right, can we refine the database?
Lovely. Thanks so much, Nick. That'll be helpful to so many people.
Pleasure.